Phyllis, you take yours off. So come on up. So, Judge, you're going to speak for. We're here today for this press conference. Come on up to announce two very important programs: the HEART program, that is Holistic Assistance Response Team, and the Violence Interruption program. Judge, thank you for coming. I know you moved some appointments around over here, so I want to start with Judge Hidalgo.
Thank you, Commissioner, and everybody who's here. Thank you guys from Sheriff's Office, Chief Finner. It's such a pleasure to have you here with us, and Commissioner, of course. I want to recognize Commissioner Garcia as well, who is not here, but did a lot of work on this as well, and of course Barbie Robinson with our Public Health Department, who is leading in so many different areas. Harris County has a three-part crime reduction strategy because it's an issue here as it is around the country. First is to reduce the dangerous backlog in our criminal justice system. Second is to protect public safety by being smart on crime in addition to tough on crime. And third, address gun violence in our community directly. Now, over the past few months, you've heard a lot about what we're doing on the first prong, on the prong about the backlog. And that's because justice delayed is justice denied. For those awaiting trial, for the victims awaiting justice, and for the community as a whole. That's why we've approved $17 million to provide law enforcement with additional technology so they can get the cases processed faster. Why we approved additional overtime for investigators and prosecutors to get through cases. Why we approved an emergency docket initiative 3 weeks ago for visiting judges. Why we approved a crop of associate judges. Why we extended jury operations at NRG. We've done everything we can to tackle the backlog, and it's very much in the judge's court to take advantage of these investments that we've made. Today, I want to talk about, and we're here to talk about, two additional initiatives that we're taking to reduce crime as part of the other two pieces of our strategy. When it comes to reducing crime, we need to focus on what works, not just what sounds tough. We have to rely on what the evidence shows will make our community safer, not just pull the same playbook from the 80s or the 90s that relied on building more jails, more prisons, and leaning on mass incarceration as a silver bullet to crime reduction. Let's talk about gun violence first. Here in Harris County, as it is across the nation, gun violence is fueling an increase in violent crime. That's why tomorrow, as part of our gun violence prevention focus, we're proposing an innovative gun violence interruption program. It's a $6 million proposal that will put boots on the ground to break the cycle of gun violence. And it's got three parts: connecting with people at risk, getting at the root causes, and stopping violence before it happens. This program is designed based on programs that have worked in other jurisdictions. And I'm very, very proud of this, and Commissioner L is incredibly grateful for your leadership on it. First, the program will connect with people at risk. It will identify individuals and areas in our community that are most impacted by violence, including even hospital patients, for example, who are victims of serious gun violent injuries. Second, it'll get at the root causes. Once the most impacted individuals and areas are identified, caseworkers from a variety of disciplines, and this is why it's under the Public Health Department, they're going to serve individuals with programs like mental health counseling, substance use treatment, employment support, support to exit gangs. Staff will work to cool down emotions, to prevent retaliations. It's a holistic program. And the third piece is the program will enlist community leaders to help us fight back at the neighborhood level, basically to try to stop violence before it happens. So workers will identify ongoing conflicts. They'll talk to key people in the community. They'll figure out what are the recent disputes, what are the recent arrests, recent prison releases, and other situations, and use mediation techniques to solve all of that peacefully, using tried and true techniques. They'll connect individuals exposed to serious risk factors, to social services. They'll try to change broader social norms around violence and gun violence. So that's on the gun violence prevention side of things. That still leaves the smart and tough on crime section of our initiative. And this is where I'm incredibly proud to be supporting this program that recruits our public health department as an additional crime fighting tool. To reduce crime, we have to break that cycle of crime, incarceration, recidivism, and get at the root causes of crime. And as we all know, too often, the root causes of crime are related to health and social challenges, like mental illness, like substance use disorders. Over the past several years, we've increased the budget for each of our law enforcement agencies, including the constables and the sheriff, each year. But we need to be finding other ways to support law enforcement too. To do this, we're hiring holistic assistance responder teams, HART, under the management of our public health department, to help free up law enforcement from having to deal with nonviolent calls involving mental health, calls involving substance use, calls involving homelessness, social welfare calls. Truth is, we unfairly rely on law enforcement to solve broader societal problems that can be addressed in other ways. We want and need police officers to be there, keeping our community safe. We also need folks who are especially trained to deal with nonviolent issues on our streets so they can address that before it leads to crime, and so our law enforcement can focus on what's related to crime. This $5 million HART initiative will work with community organizations to build teams that work on behavioral health, on mental health, and already they've launched a request for proposals for interested partners. We need to make sure that when calls come in for nonviolent issues like mental health or welfare checks, that we're not taking cops off their beat who are focused on violent crime to deal with something that mental health and health professionals can deal with. And so it's needless to say, both the gun violence prevention program and the HART program will be thoroughly documented. They'll be complete with metrics, with evaluation systems. We expect the Public Health Division to launch that will house both of these programs by the end of the year. And look, as an example, we have a similar sized program in San Antonio, saw reductions in the number of murders a year after the implementation in the 4 neighborhoods with this kind of a program presence. Similar investment in Philadelphia had a 30% reduction in shootings over 2 years. So we're trying to build on what works. We're trying to be smart, creative. We need to push for a smart and thorough fight against crime in this community, and that's what I'm proud to be doing today alongside Commissioner Ellis and these incredible law enforcement leaders. So thank you to everybody here. I'm going to repeat very briefly my remarks in Spanish, and then I know Commissioner Ellis has additional remarks, as well as obviously Chief Finner, Chief Toquica. En el Condado Harris estamos trabajando en reducir el crimen. Tenemos un plan de 3 partes. La primera parte es atacando el retraso, tantos casos que están atascados en nuestro sistema penal. Hay decenas de miles de casos acumulados en las cortes. Segundo, es proteger la seguridad pública siendo inteligentes contra el crimen, tanto duros contra el crimen como inteligentes en las estrategias. Y finalmente, el abordar la violencia armada en la comunidad, mucha violencia por armas de fuego. En los últimos meses hemos hablado muchísimo acerca de la primera parte, acerca de la acumulación de los casos. Por eso invertimos $17 millones en equipo adicional para policías para que pudieran procesar los casos, trabajo adicional, fondos adicionales para fiscales, para investigadores, jueces, más inversiones para jueces adicionales, como también agencias, horas extraordinarias adicionales en cuanto a para el jurado en el edificio de NRG para que las operaciones se extendieran. La justicia retrasada es justicia denegada y por eso estamos invirtiendo tanto en poder pasar esos casos rápidamente. Ya en este momento la responsabilidad está en manos de los jueces, pero hemos puesto todas las inversiones necesarias. Hoy día estamos anunciando 2 propuestas más, en el tema de la violencia armada y en el tema de ser estratégicos e inteligentes en cuanto a cómo abordar este incremento en el crimen. Tenemos que trabajar en lo que funciona para reducir el crimen, no solamente en lo que parece ser mano dura. Tenemos que confiar en lo que la evidencia muestra ser lo más eficaz. En lugar de utilizar las mismas estrategias de los años 80, los años 90, que llevaron a encarcelamiento masivo, a construcción de muchas prisiones y que finalmente no redujeron el crimen. Hablemos primero de la violencia armada. Aquí en el condado Harris hemos visto un incremento en la violencia armada como se ha visto alrededor del país. Entonces estamos lanzando un programa de interrupción de violencia armada. Son $6 millones que van a poner individuos en las comunidades más impactadas. Primero, conectar con las personas afectadas. Segundo, trabajar en los problemas de raíz. Y finalmente, trabajar con la comunidad para prevenir la violencia antes de que suceda. Iremos a hospitales, por ejemplo, a visitar víctimas de violencia, hablar con ellos, ir a las comunidades donde hay más violencia. Ya que hayamos identificado las comunidades, trabajaremos con grupos de varias disciplinas para apoyar la salud mental, el abuso de drogas, necesidades de empleo, apoyar a que las personas salgan de las pandillas, tratar de prevenir esa violencia, ese ciclo de violencia. Y finalmente trabajaremos con comunidades para trabajar en mediación, para resolver las disputas de una manera pacífica. Esto está basado en programas que han funcionado alrededor del país. El segundo anuncio recluta a nuestro Departamento de Salud Pública también para utilizarlos a ellos como un recurso para luchar contra el crimen. Se trata de romper ese ciclo entre el crimen, la cárcel, las ofensas nuevamente, crimen nuevamente. Muchas veces la raíz del crimen no es la violencia, sino son problemas de salud mental, son problemas sociales, son problemas de abuso de drogas. Entonces, además de que hemos incrementado en los últimos años el presupuesto para nuestros departamentos de policía, tanto el alguacil como los cónstablos, también tenemos que apoyar a la policía con alternativas. Por eso estamos creando estos equipos. Estos equipos se llaman equipos HEART, son equipos de asistencia a la policía y son equipos que van a ayudar a responder a casos de salud mental, casos que no son de violencia, casos de personas sin hogar, por ejemplo. Queremos que estén los policías afuera trabajando en temas de violencia, pero necesitamos darles el espacio para que no tengan que responder a temas que son más sociales, que son más de salud mental. Entonces, esta es una inversión de $5 millones que se asegurará de que no tengamos que pedirle a un policía que está respondiendo a una llamada de violencia, de crimen, que vaya y trate a una persona sin hogar, a una persona que tenga un tema de drogas, una persona que tenga un reto de salud mental. Obviamente, ambos programas, tanto el programa de interrupción de violencia armada como este programa de apoyo a salud mental, de apoyo a personas sin hogar, ambos programas han sido basados en programas que han funcionado en otras áreas. En San Antonio, por ejemplo, en la ciudad de Filadelfia. Ambos programas se van a evaluar a mucho detalle para ver qué impacto están teniendo y vamos a cambiar el programa a donde sea necesario para que realmente funcione. Pero mire, este reto de crimen es serio, está sucediendo en todo el país, estamos atacándolo con todo lo que tenemos en el condado Harris y siendo creativos, siendo inteligentes, seguiremos evaluando qué más podemos hacer, pero estoy muy orgullosa de esta inversión. Estas 2 inversiones son alrededor de $11 millones en adición para combatir el crimen en la comunidad. Thank you so much, Commissioner Ellis.
Thank you. Thank you, Judge. In the case some of you in a hurry, I'm going to say my comments in Spanish first, give you a chance to digest them. Then I'll do it in English. Seriously, I want to thank my staff, first of all. Judge, we voted unanimously to start both of these programs about a year ago, and I was pushing my staff about every couple of months, just put it on the agenda. But thanks to the folks at the Harvard Government Lab and my staff, your staff, all of the commissioner staffs, I think we came up with a very good program. Look, the most important people here today are the people to my left in law enforcement. And I want to make sure that I hit that issue head on for both of these programs. We believe in funding law enforcement in Harris County. In fact, the law enforcement budget has increased every year since I have been a commissioner. Budgets have increased at least for the last 6 years. There's 1 year before I got here. In fact, from last year to this year, it went up $16.5 million from the previous year. Justice and safety account for 60% of our general fund budget in Harris County. Law enforcement alone counts for 36% of the general fund budget. These two programs will cost a total of 1.5% of the law enforcement budget, and they do not come out of the law enforcement budget. I want to thank Sheriff Ed Gonzalez in particular for his steadfast commitment through this process. And I think when our staffs are working together, it was his staff and the sheriff initially that said these programs should not be in the sheriff's office. That is why they are in the health department. Everyone in Harris County deserves to be safe. That's why we're here today to announce these two great programs, the Gun Violence Prevention Program, and moving forward to launch a more targeted first responder program. As the judge said, these are two proven initiatives. We looked around the country to see what worked best, to learn from other models in other jurisdictions. These initiatives will lead to a new division of community health and violence prevention services within the Harris County Public Health Department. As I mentioned, the Sheriff's Office played a key role in putting this together, and the Police Department. Mayor Turner and the Chief, along with my staff in the Health Department, Chief Takika and Mike Lee were on a call yesterday, which was supposed to last an hour, but everybody was supportive. I know statements are coming forward, and we put them out already, so we managed to do it in 27 minutes. Judge Hidalgo, I want to thank you in particular for your steadfast commitment. None of us are going to sit by when we can do something to prevent deaths in our county. The first of the new programs the Harris County Commissioners Court will vote on tomorrow, hopefully will pass, with the Gun Violence Prevention Program. The program will work with individuals at highest risk for gun violence. We will meet them where they are, in their neighborhoods, in hospital emergency rooms, right after a violent injury. Programs like this have a proven track record of reducing crime. Credible messengers, as the judge mentioned, will do the outreach, and staff comprehensive casework management teams to get people on the path towards stability. 3 types of interventions are not only smart on crime, but they're also cost effective and they save lives. A $2 million violence reduction program in Boston, Springfield, Massachusetts generated close to $15 million in savings from decreases in crime. In 2021, Houston's homicide rate was more than double Los Angeles's and almost 4 times the New York the crime rate for homicides. Los Angeles City and the county have invested a combined total of almost $40 million in community-based violence prevention work. Harris County will vote to start this program, hopefully, with a $10 million investment tomorrow. We expect the program to grow, and become countywide. We're also moving forward with the HART, that stands for Holistic Assistance Response Teams. HART will improve public safety by sending the most appropriate responder to nonviolent calls involving mental health, substance abuse, homelessness, and social work calls. 911 dispatch will dispatch teams of first responders who have behavioral health and medical training. This frees up the folks to my left in law enforcement so they can handle the more serious issues and be available to handle emergencies. If there's a burglar in your house, you need a cop. But if someone is having a mental breakdown on the corner, you need a trained medical professional. I think that we unfairly rely on law enforcement to solve everything we can think of, and that's just not fair. It strains first responders, and it overcriminalizes public health problems and deprives people of health-based treatment that they need. Members of law enforcement agree. In a nationwide survey, more than 2,000 law enforcement officers, more than 70% reported that the amount of time their department spent on calls for service involving individuals with mental health issues increased during their career. Hart will get the right people for each call. For instance, Denver started a similar program last year, and 35% of their calls came directly from the Denver police dispatching health-based responder teams. In the first 6 months of the program, none of Denver's 748 calls led to a call for police backup or arrest. As HART expands throughout the county, it will eventually become a fourth pillar of the first responder system. Of the three would be law enforcement, obviously, EMS, and this will give us a fourth one in addition to law enforcement and EMS. Harris County joins places like Denver, Phoenix, New York, Oakland, Chicago, San Francisco, who are all expanding the scope of their first responder programs. As the judge mentioned, Harris County hopes to budget $5 million to start the program, one geographic area of the county, with plans to expand in coming years. Of the two programs, the alternative responder program, I-911, so far, Chief, is not the same as the one that you all have at the city. That's a separate issue for another day, but we ought to figure out how to make that work. These programs add additional tools to the toolbox to make our county safer. Now I want to turn it over to Chief Takika, if I might, to make a few comments.
Thank you. Good afternoon, and thank you for joining us today as we launch this pair of innovative programs designed to make Harris County a much safer county. I'm honored to stand here with Judge Hidalgo and Commissioner Ellis, along with these other fine leaders, to briefly discuss our collaborative initiatives. We are fortunate to be able to work with Director Robinson's team at Harris County Public Health to design and develop these strategies. On behalf of Sheriff Ed Gonzalez and the Harris County Sheriff's Office, I want to thank all of you for your support. The first program is the Harris County Gun Violence Interrupter Program, which recognizes and addresses the early warning signs of impeding gun violence. This program proactively engages people involved in potentially volatile conflicts by resolving issues before they escalate and subsequently result in gunfire. We believe that these programs are going to save plenty of lives in Harris County. Our frontline deputies and officers are used to interviewing people who survived gunshot wounds and other violent attacks at the emergency hospital rooms, but often we see that these people attacked intend to exact their own version of justice on our streets. Until now, deputies have not had the non-violent resources to offer these individuals. The Gun Violence Interrupter Program is a new resource that will break the cycle of violence and vengeance. We are equally excited about the second program, which will be launched under the leadership of the Public Health Department. HART, which is the Holistic Assistance Response Teams. When residents of Harris County call 911, it's because they find themselves in a situation that they can't get out of. Until now, our call takers have had three options to provide these residents, which is fire, EMS, and law enforcement. However, a significant number of callers need a different resource. They need help dealing with nonviolent crime. So that's where non-criminal social welfare issues such as homelessness, mental illness, disorderly intoxication, drug overdose, and juvenile truancy, along with panhandling, just to mention a few, is where it's going to be vital. This is where HART comes in. HART offers a smart fourth choice or option for these callers that do not necessarily require a police response or presence. We've learned that placing our deputies in untenable positions that require a unique skill or training on behavioral health and emergency medical personnel is not fair to the officer, and it's not fair to the person needing assistance as well. Just as importantly, HART will result in peace officers having more time to respond to calls with a criminal nexus involving violent crime and proactively addressing threats to our public safety. We believe these two programs will have a major and positive impact on our community and will contribute to a safer Harris County. I'd like to say that the Sheriff's Office runs the largest jail in the state, but we also run the largest mental health care facility in the state, and it shouldn't be that way. So HART is going to be a true diversion program and is going to really work to supply the people the help that they really need. Thank you.
Thank you. Next, Director Robinson. In fact, your counterpart in the city, Stephen Williams, was trying to get him, he still may show up with Director Robinson.
Good afternoon. I'd like to thank you, Judge, Commissioner Ellis, for your leadership in bringing these important violence prevention programs to Harris County that will be led by Harris County Public Health. I'd also like to acknowledge all the other county and city leadership for their support of these important initiatives that complement all of our efforts to reduce violence in our communities. Interpersonal violence, or violence among individuals, is a major public health challenge in the United States. Nationally, homicide is one of the leading causes of death among youth and young adults of color between the ages of 15 and 34. In Texas, Black and Latinx men together make up less than 25% of the population, yet they represent nearly 63% of the state's gun homicide victims. Additionally, Black men ages 18 to 24 are nearly 11 times more likely than white men of the same age to die by gun violence in Texas. In 2020, Harris County homicide rate increased by 41% from 2019. Locally in Harris County, homicide is the leading cause of death of Black children aged 0 to 17. These local statistics highlight the urgent need to address violence in our communities. We cannot rely on law enforcement to do every job and prevent every problem. We need to invest in public health prevention and holistic interventions that address the root causes of violence. Public health approaches to violence prevention are effective in reducing violence in communities because they focus on identifying the risk factors that increase the likelihood that a person will become a victim or a perpetrator of violence, and those protective factors that are necessary to reduce those risks. Public health approaches bring together services and interventions from social services, economic and employment, behavioral health, and other safety net services and programs to improve the well-being and self-sufficiency of individuals, which are so critical in changing people's life trajectories and life paths. Harris County Public Health, under the leadership of the Judge and Commissioner Ellis, will be establishing a new division of Community Health and Violence Prevention Services. This division will provide the strategic direction, administration of these 3 evidence-based programs that you've heard all of us talk about today, 2 of which are really designed to focus and target on breaking the cycle of violence. And we've talked about the Violence Interrupter program, which brings credible messengers who have the lived experience to work with individuals in the community who are at risk of being involved in violence. And then we have the hospital-based Violence Interruption program, where we're meeting folks in the hospital who have been the victims of violence to work with them on interrupting violence in that cycle. And then, of course, you've heard us talk a lot about the holistic, the HEART team, which is the Holistic Assistance Response Team, which is really bringing the right resources to the right calls at the right time. And we know that this program works, and it's going to be effective here in Harris County. The newly formed division will be partnering with the City of Houston Health Department, as well as other safety net departments in the county. We cannot do this work alone. We need to focus on the root causes of violence and bring all of our interventions in a coordinated way to enable folks to get on the right path and to a better life of well-being and self-sufficiency. And so with that, I will turn it over back to Commissioner Ellis. Thank you.
You might believe if I didn't call your name out, I should have, because throughout this process, you've just been a delight to work with. Chief Fenner, I appreciate you being here. I know you had to deal with family issues. I didn't know until we were talking yesterday that I knew your mother, and I'm just so glad you would be here. You're right, we did a call with you and the mayor yesterday, but your support is so important. Chief Fenner.
Hey, thank you, Commissioner. I want to say, first of all, good afternoon. This is a big deal. You cannot truly love Houston unless you love Harris County. You can't truly love Harris County until you truly love Houston. We're one. And I want to say that I'm so excited and so proud to stand with Harris County, the commissioner, and I'm going to say my county judge. We had conversations months ago, and we were telling people things that we're working on. Now our public is beginning to see it. So I'm so excited about both of these programs. All I want to say is we're going to work together as one to reduce crime and do whatever we need to do. We're going to hold ourselves accountable, but we're going to stand up for citizens in our city and our county and get things rolling the right way. I am so excited. You hear so much talk around the nation, around our county, defunding the police, do this, do that. Nobody's defunding the police here. And I'm glad you said that, okay? Because y'all have supported us. I want to thank our city council, our mayor, who funded $25 million over 3 years. The same programs, different names. But what I want the public to know is we're working in concert as one team. We never should have been responding to scenes where people are suffering from mental illness, people who are suffering from addiction. We need the true professionals to step in, and thank God for funding that. And we're going to move together as a team. But I am excited today. I'm going to step down and address questions if we need to. But thank you. I'm very proud of you, and we're going to continue to knock down this crime together. Thank y'all.
Hey, Chief, I'm impressed. I guess I asked you to come when we finished the Zoom call yesterday. I'm glad we cut the call to 27 minutes, but thank you for putting on short notice. The judge and I, the experts, Barbie, come on up here. Don't be bashful. Any questions? We'd be more than happy to try and answer them.
The team, the heart team, how many people is that going to be made up of?
We're currently working to put the teams together, and we'll have more information. It's really, we're waiting for the court to approve the programming, but we've been working behind the scenes. It consists of multidisciplinary teams made up of mental health professionals, social workers, EMS professionals, medical service professionals, and so we'll have more information as we move forward with standing up the program.
May I follow up with you? Excuse me, ma'am. I have a quick question because you had some numbers. I just want to follow up with them. And because the county and the city can kind of blend at times, and they're obviously different in other situations. So when you indicated, ma'am, that homicide is the leading cause of death in black children 17 and under in Harris County, is that strictly Harris County numbers, or does that include the city of Houston?
That includes all data.
Perfect. And when you said 41% Harris County increase, are those numbers from the sheriff's office, or are they from everybody's numbers as a whole combined?
It's state data on death data.
Briefly, folks, the judge has to go in a minute or two, so if you have any questions for her, I want to give you an opportunity to ask.
And I do want to add on the point that Director Robinson made is if you look at the size, the investment, dollar amount of these programs around the country, and especially when you look at it with population incorporated into it, it's quite substantial, the 11 million. It's, as Commissioner Ellis said, it's something that we hope will grow even more, and that's why we're going to be evaluating the outcomes. But this is very much not a sort of pilot program sized investment. It is significant.
When you mentioned evaluating the outcomes, pardon me, Chief, I noticed on this board here, we talk about Philadelphia's had a 30% reduction over the last 2 years, and Richmond, California has had a 50% reduction in gunshot wounds from 2007 to 2019. Do we know how this is performing in real time? And I ask this because in the last year there has been an increase, a significant amount of crime nationwide. I can tell you right now that the Philadelphia numbers went up from 2,365 in 2019 to 3,947 in 2020. So that's saying there's a 30% reduction in shooting over the 2 years when Philadelphia tells me they've gone up that much. So can you guys kind of break down these numbers? Because Richmond's also posting a higher homicide rate here. And it's indicating 2007 to 2019, but in today's time, the city of Richmond is seeing an increase of homicides of 69%. So I'm just trying to get an idea. Have you guys examined the numbers to where they're at today to see how long these programs have been in place? And because of the last year, what changes have they seen from the numbers you have?
Yeah, and part of what you want to do is you want to measure outcomes, not outputs. So what we don't want to say is simply how many people did the heart team talk to, for example. Yes, that's necessary, but that's not sufficient. You want to figure out to what extent, to the extent possible, to what extent can we draw a nexus between the initiative and crime being prevented or crime going down. part of what we're going to be doing, or the departments are going to be doing as the weeks and months go by, is digging into those very questions, which is, okay, what exactly are we going to measure so that we can see whether there's progress? Where exactly have the changes been shown in these different jurisdictions? But with the research that has been done, this is something that has made a positive impact
Well,
elsewhere.
If you're asking for the taxpayers of Harris County to fund this program, shouldn't the numbers, Commissioner Ellis, be reflective of what we're seeing today? Because you're stating up here, Philadelphia is a 30% reduction in shootings over the last 2 years, and I'm here to say that that's not the case, according to the city of Philadelphia.
I'm sure we can follow up with information. As you know, crime is up in certain crimes and down in other crimes. Perhaps they're picking a particular subset of, whatever it is. Obviously, I don't have that as my fingertips, but we'll follow up with the staff. But the point is, if it's Portland, if it's Philadelphia, if it's Los Angeles, there's been various areas. These are not new programs, but part of what will be requested from the departments, and I'll be pushing for this tomorrow, is that they come back to Commissioner's Court, as we're doing throughout Harris County, and this is new since we came into office, is asking, what are you measuring, and how are you going to show us as members of court and the public, how are we going to show whether or not this is working? It's a complicated issue. None of this is linear. You're dealing with humans. You're dealing with people. It's not, 1 + 1 = 2, but there are ways to measure, and we want to make sure that we're coming up with a way to do that.
Logistically, what would this look like? I know you mentioned boots on the ground, so would this response team be riding with officers in cars, or would it be, what would it look like logistically?
The idea is to not burden law enforcement unless they need to intervene in crime-related issues. So the idea would be if it's a solely mental health, solely substance use, for these teams to be called first, and then they can request law enforcement if necessary, so that law enforcement we're not pulling them off of violent response. Now, in issues that have a mental health component, that would be the idea, is that there is some support coming into it. But the specific details, they'll be worked out as the program is developed. And part of what I think makes this program strong is there's a dedicated division within public health that will house these programs. There's been something along the lines of, let's train folks specifically for mental health. There's been sort of attempts at this, but generally speaking, there has never been this focused, single division, massive investment, and the results are clear. Again, it's multifaceted. We also need a stronger mental health system writ large. We need better coordination. But when your jail is the largest mental health facility in the state, there's a problem. And what we're trying to address here is not just the crime that is up in the county as it is around the nation, but also the broader question of how can we be as smart as possible in supporting the law enforcement and supporting our community.
Juez Hidalgo, si tiene alguna actualización sobre la situación con la pandemia, número de hospitalizaciones y el índice de positividad, por favor.
Las hospitalizaciones, el índice de positividad y los casos continúan incrementando de una manera casi exponencial. Estamos todos extremadamente preocupados por el inicio de las clases. Entonces, lo que estamos haciendo ahora, primero, lo más urgente, es pedirle a todos que se vacunen. Es crucial. Tenemos un problema con el hecho de que no hay suficientes enfermeras, no hay suficiente personal médico disponible. Hay muchísimas enfermeras que han trabajado ya casi 2 años en la pandemia, están exhaustas. Entonces estamos viendo a ver cómo podemos hacer para traer más trabajadores, más profesionales médicos a nuestra región. Y finalmente, el uso de las mascarillas en las escuelas es algo que sigo pidiendo a los distritos escolares que trabajen en eso, porque a cómo van las cosas, todavía no hemos controlado esos números, siguen fuera de control y siguen incrementando de una manera significativa. I apologize, I have a commitment at 2 that I have to get through. Yeah. Oh, okay, briefly. So the question was about the COVID numbers. they are still increasing, whether it's hospitalizations, whether it's cases, whether it's positivity rate. And so the urgent request is for people to get vaccinated. That's most important. After that, of course, for folks to avoid the emergency room unless it's a truly life-threatening situation. And you know, I'm very concerned about masks in schools as our students, our children are going to be going back to school soon. We can't simply wish them good luck as they show up and hope that the other families are concerned about the health of kids that are not their own. So look, it is a concerning situation. We can turn things around, but as a community, we need to work together. We need to work with the masks. We need to work on the masks in the schools. We need to get vaccinated, and we're going to continue to do everything we can to lower those barriers to vaccination. I mentioned also we have a shortage of nurses. A lot of nurses are burnt out. They've been working for 2 years. And so we're trying to see what we can do to bring more nurses to the region, but it's a challenging situation.
Judge, en función de eso, ¿está el condado planeando o pensando en reabrir el medical shelter como que estuvieron en el NRG o alguno parecido para atender justamente que no hay enfermeras, todo lo que viene con el COVID?
Bueno, el refugio médico que abrimos en el año pasado fue porque teníamos en ese momento el personal necesario. No se trataba más de camas, de camillas hospitalarias. Estamos considerando si es necesario abrir otro refugio, pero la necesidad más urgente el día de hoy, que es un poco distinta, es la cantidad de enfermeras y enfermeros. Eso es la prioridad. Entonces, no tenemos planes ahora mismo de abrir otro refugio. Estamos más enfocados en las enfermeras, pero sí es algo que estamos considerando. And the question was about the medical shelter and whether we're planning to open a medical shelter as we did last year at NRG. Right now, the most immediate concern is the nurses. And so, of course, the most immediate concern truly is vaccinations and is the unvaccinated population staying home as opposed to spreading the virus. But you know, we're considering whether a shelter is necessary. It's not something that is top of mind right now because the beds to some extent are there. The concern is the staffing. So we're going to continue pushing through that. But the way to address this is to bring the numbers down by wearing masks, by avoiding contacts if you're not vaccinated, and of course, by getting the vaccine.
¿Qué nos
Thank
han
you.
dicho del centro médico sobre las camas? Sabemos que cada vez están bajando más y más los números de la disponibilidad de camas para atender pacientes en cuidados intensivos.
Sí están bajando el número de camas en el centro médico. Hay camas todavía, pero el problema es el personal médico. No hay suficientes profesionales médicos. En los hospitales públicos estamos prácticamente ya sin camas. Entonces ahí es donde les pido a todos que no vayan al departamento de emergencia si no es urgente. The question was about the medical center beds. Of course, the beds are being reduced day by day. There are still some beds, but there's also a huge shortage of medical personnel. In our public hospitals, we're pretty much out of beds. So that's why the request is to not go to the emergency room unless it's a life-threatening situation. And to remember, this is not something theoretical. This is real. This is real for our community, for the ambulances that have longer wait times, for the folks that are having to be airlifted to other states even. If you have any doubt or had any doubt about getting the vaccine, look around you. Look around you at your community. It's time for everybody to do their part. It's well past time. Thank you.
The judge has to run, but the press conference can continue.
Thank you. Look, I want to say that they were both very valid questions earlier. On the numbers, we'll stand behind them, but my staff will walk you through what capsule in time they were looking at. And most of that came from folks at the Harvard Government Lab. But look, I do want to say that you talked about unprecedented times, an economy in shambles, mental health issues off the charts. We happen to be in a region where there's a tremendous culture of gun violence. And I want to encourage you, don't confuse the two programs. So one being the HEART program means that when you dial 911, most of us dial 911 for just about everything. Somewhere in the stats, I don't remember the number, I think it was from the Sheriff's Department, about 2% of the calls involved violence. I think the number at the city was slightly higher. but people call for everything. So somebody has to make a decision when you add a fourth option that you can get. Police, fire, EMS. This one will be, you'll get a health care person responding. Look, I did ask the question, I can't remember who the official was, somewhere in North Carolina, I think, about what problems came up. Well, yeah, sometimes maybe it looks like you needed a healthcare responder, and as it turns out, you needed law enforcement. And then quickly, you got to make sure they get there. But that's the distinction on the two. And then on the second program, make sure you talk about violence interruption. We're talking about a lot of these disputes that I have read about are really fairly insignificant things. Somebody's angry because somebody said something bad about someone in their family. The reason it's not in the police department is you want to get folks who are trusted messengers who can go in and meet, and sometimes they are people who've been in that world, by the way. There's some that sometimes, Chief, I may think I can relate to because of where I came from. Maybe I can't because of where I am. You got me? But look, when she lays it out tomorrow to Commissioner's Court, I think with you and the mayor on yesterday, it was helpful to me to have the slides kind of walking through the two programs. And most of us have a tendency to want to combine the two. But I just think that's important.
Will there be a component of law enforcement training at all with the therapists?
Yes. So we're gonna a lot of this money is going to go into making sure these are people who are certified to do what they're going to do. We're just picking someone up off the street and saying, try this. And we get the benefit. One good thing about being after the rest of the country is you get to benefit from some mistakes that happen along the way. And maybe we're going to find out about some new mistakes. Yes, number 5.
So we spoke a lot about today about the side of gun violence and preventing it. What do you have to say to people that have already been victim of gun violence, and us on the news, we report these shootings and then we say you guys are looking for a suspect, weeks go by, and one, families lose hope, and two, people out there have the impression that, hey, you can get away with this. Yeah. So what do you have to say to the families and the people?
First of all, I want to say that all families are important to us, and each and every victim of gun violence in our city is important. But we need to stick together. And it's kind of simplistic, but that's what we need to do. You can, the numbers regarding homicides are going down the last six weeks. A lot of people don't know that. We're going to put that out. But we got to hang in there together. And the most important thing, when you're talking about shootings and homicides, we got some really good police officers, okay? And some really good detectives. But at the end of the day, you know who solved those homicides and shooting crimes? Our biggest force multiplier, those citizens. And I have been encouraging them to step up and report. And I think they've been doing it. So we're going to continue to work together. All right?
With the concern about rising crime, gun violence, and the worries the residents have, do you have any concerns with the permitless carry law that's going to take effect September 1st?
The chief of police is always concerned when you got more guns on the streets, okay? And I'll tell you this, and I'm not a political person. I love our politicians, but I stay away from it mostly, okay? But when you have a backlog, and it's not only in Harris County, a backlog nationwide, and you have people that are really convicted felons because of what they have done, but they hadn't been in court, and you're going to have all those individuals out there, and because of this new law, they can legally pack, that's a problem. But let me tell you something. We got sophisticated people in Houston and Harris County, and we're going to work together. We're going to get through it. I don't want to hit the panic button, but we got to watch out for one another even more so. Okay?
So my answer would be hell yeah. We've heard about a permanent carry law. Next question. A couple of more.
How significant is it to have the proper makeup of the community in these front row positions that are going to be created?
I think it's important. It helps a lot. But even more important is to make sure that people are properly trained. One concern I have from looking at some of the press accounts of other places that have done similar programs is sometimes people in the community see it as an opportunity to get involved. But they may not have a 501c3. I'm talking about the violence prevention program. Or they may not be willing to take the time to get the training. And a few elected officials I've reached out to told me the quickest way to blow it up would be somebody getting hurt or trying to do the right thing. So we're going to do the best we can. We have to explain to a lot of people, yeah, we want you to be involved, but you got to get certified. You got to get the training.
And I guess also, I'm also trying to get there, and I think you understood that.
You want a mic? You're the expert. Come on
No,
up
I
here.
was just trying to say that, like, in certain communities, you're gonna feel much more comfortable speaking with someone who may
Of
understand
course.
what that community is.
Yeah.
Even in law enforcement, so to have that proper race representation with regards to
Yeah.
the first responders, how pivotal is that going to be in this program?
Very much so. That's my answer. but
Yeah,
you-
I mean, I think it's critical. And we were just looking at the numbers today, breaking down the shootings and the demographics of the victims. And I think the makeup of the team should probably reflect those numbers.
It'd be a little hard for someone to walk into the community and be a trusted messenger if the community speaks Spanish and you don't. If the community maybe uses a certain dialect and you don't. So that is important. Barbara, you want to comment?
I was just going to say, it is incredibly important that the staff are bicultural as well as bilingual. And that is, some of the requisite requirements that we're going to be looking for. Credible messenger, credible, that's what it means, right? That you're able to identify and relate to those individuals you're supporting. And so that's the model.
And can I get your full name again? I'm sorry.
Barbie L. Robinson.
You health director for
Ms.
Harris County.
Robinson, I'm sorry, I'm jumping out of time.
Thank you.
I wanted
Thank
to
you,
say
Chief.
welcome to Houston.
Thank you.
Harris County,
Thank you.
welcome. Thank you.
She grew up in Arkansas, so she knows about the humidity.